Okay, so we'll pick up where I left off. For a lot of people in this course, the hardest thing is learning the words. The terms are Latin or Greek, and the only is we've standardized the names. 1998, they all got together and approved the words. They standardized them. We got rid of all the things that were named after people. Uh, for instance, we don't use the term fallopian tube anymore. As it turns out, that was named for some guy. We now say uterine tube, which is actually more descriptive. And we've kind of gone with a system now. So the words are standardized. Sometimes they're hard to spell, but we'll get there. It is important that you learn to say the words right and spell the words right. Sometimes they're very close, like ilium and ilium. One of those is the hip bone, and the other one is a segment of the small intestine. There are several other things like this, especially in bony markers, where we change one letter and we change the structure. In terms of saying things correctly, you just don't want to sound stupid. So pronunciation also important in terms of people understanding you, and so they don't laugh at you later. We also use specialized directional terms, superior and inferior. We'll work these in slowly through the semester. So don't worry a whole lot about just straight up memorizing them. It's one of those things where, much like languages, immersion is probably the best way to learn this. But all directional terms will refer to someone who is in anatomical position. In anatomical position, the palms are facing forward, or the forearms are supinated. The reason that's important is because when the forearms are supinated, the radius and the ulna are parallel. If you pronate the forearm or you turn the palm toward the back of the body, the radius crosses over the ulna, and it makes it difficult to describe its position. We also talk about several directional planes: sagittal, transverse, and frontal plane. The sagittal plane divides the body into right and left halves, so here you see a sagittal section of the pelvic cavity. The frontal plane divides the body into front and back, or anterior and posterior, so here's a frontal section of the thoracic cavity. The transverse plane is the horizontal plane that divides superior from inferior, so we get a transverse section of the brain here. This, for instance, is what you would typically get in a CT or an MRI, are these very thin horizontal slices. So here are some important directional terms. Ventral and dorsal are front and back. Anterior and posterior are also front and back. Superior and inferior are above and below. Medial means toward the median, or toward the middle of the body. Lateral means away from the middle of the body. Proximal means closer to the point of attachment, and distal is further away. For instance, the wrist is proximal to the fingers. The wrist is distal to the elbow. Superficial means closer to the body surface, so the skin is superficial. Deep means further inside. So, for instance, the muscle is deep to the skin. Left and right always refers to the organisms, or in this case, the patient's left or right, not your left and right. That's important, so make sure that you're always referring to the patient's left or the patient's right, not as you look at it. Caudal and rostral we don't use a whole lot. Ipsilateral and contralateral means on the same and on the opposite side. We will use contralateral once we get to the nervous system. Visceral always means associated with an organ, and parietal means it's associated with the wall of a body cavity. Specific regions of the body get special names as well. Axillary and brachial. Again, I don't expect you to just memorize these. It's not essential in that way. You get to that point through, using the terms repeatedly. And some of them you'll use more than others. The abdomen is often divided into quadrants, each quadrant containing specific organs. Within the body, we have different cavities. Those cavities are lined by membranes and then filled with organs. So the dorsal body cavities, the cranial cavity and the vertebral canal, so that's where we find the brain and the spinal cord. The ventral body cavity is divided into thoracic and abdominal. So here we see that lateral view there. We can see the dorsal body cavity with the brain and the spinal cord. And then the ventral body cavity with the thoracic and abdominal cavities. Thoracic and abdominal cavities are separated by the diaphragm. Here's a ventral view of that. Here are the lungs sitting in pleural cavities, surrounded by the pleura, which is the membrane around the lungs. Here's the heart surrounded by the pericardium and the pericardial cavity. We get to learn anatomy systematically this semester and next semester, which means that we get to go system by system. If you take gross anatomy, to learn anatomy regionally, because you're learning anatomy as we go through a cadaver. So, as you dissect the person, there's only one shot at taking, for instance, the arm apart. So you learn bones and muscles and nerves and blood vessels of the arm. Here we can go system by system, which does make life considerably easier. For AMP1, we have the skin, the skeletal system, the muscular system, and the nervous system. Everything else is for AMP2. We will see major themes pop up throughout the semester. Cell theory is one. Homeostasis we'll talk about briefly. And the idea of evolution. There are many structures that we'll talk about that are difficult to understand without looking at our relationships to other organisms. One reoccurring theme is the hierarchy of structure. We'll start always with the cells and work our way up from there. But the big overarching theme of anatomy and physiology is the unity of form and function, where all anatomy is the result of physiology, and all physiology is made possible by anatomy. Now, we need to spend a minute with the idea of homeostasis. So, homeostasis. Homeostasis is the tendency to maintain a constant internal environment. It's kind of the goal of your physiology. Homeostasis is maintained by a process called negative feedback. Negative feedback happens when the product of a system inhibits the system. So, when you think about this, think about the thermostat in your house. The thermostat, let's say that you set your thermostat at like 70 degrees. When the temperature in the house exceeds that, the thermostat turns on the air conditioner, which produces cold air. That cold air comes out, the temperature in the room drops, and the thermostat turns off the air conditioner. So in this case, the product of the system, the cold air, shuts off the system. Negative feedback is how homeostasis is maintained. We'll see this over and over again, where the product of a system shuts down the system. So what you get is what's called dynamic equilibrium. If we were to graph something, body temperature or calcium levels in the blood, or different components, what you would see instead of a flat line is this. Again, this is dynamic equilibrium, where a value varies within a set range. So your body temperature, for instance, on average is 98.6. Does that mean that it's just a flat 98.6? No, it varies throughout the day. And if it goes up above a certain temperature, mechanisms kick in to cool you off. And as you cool off, that shuts off. If it goes down, mechanisms kick in to warm you up. And as you warm up, that shuts off. And so this is what we get. If we graph your body temperature throughout the day, we'd see these fluctuations, and that's how homeostasis is maintained, not just as a flat line. Again, through the process of negative feedback. Positive feedback is also a thing, but it's not a topic that we need to talk about this semester. Positive feedback will come up next semester as we talk about labor contractions and blood clotting. Most homeostasis is maintained through this process of negative feedback, when the product of a system shuts off the system. Okay, so the next lecture will be a brief overview of chemistry things. It's not the substitute for any sort of chemistry. If you've already had chemistry, you should be good anyway. But it's just a brief review of things so that we're all on the same page, and we can focus in on the little bit of chemistry that I do need you to understand so that we can move forward to the cells.